Does your blood type affect your health and the aging process? Blood type is a genetic trait that each person inherits from their parents at birth. The ABO blood group system consists of four main blood types: A, B, AB, and O. For many years, scientists have studied whether blood type influences the risk of disease, lifespan, and the rate of aging. It is important to understand from the outset that there is currently no scientific evidence proving that any blood type causes people to age faster or live shorter lives. However, numerous studies have found that each blood type may be associated with a slightly different risk of developing certain diseases. These risks are generally modest and are strongly influenced by diet, lifestyle, physical activity, sleep, and many other genetic and environmental factors. In other words, your blood type does not determine your destiny. It is simply one of many factors that may influence your overall health. Blood type A. Some studies suggest that people with blood type A may have a slightly higher risk of cardiovascular disease than those with blood type O. In addition, several studies have reported an association between blood type A and an increased risk of stomach cancer, particularly in individuals infected with Helicobacter pylori. Research has also suggested that people with blood type A may experience a stronger inflammatory response when facing infections or prolonged stress. If chronic inflammation persists for years, it may contribute to fatigue, slower recovery, and an increased risk of age-related diseases. However, this does not mean that everyone with blood type A will age more quickly. To help protect their health, people with blood type A should eat a diet rich in vegetables, fruits, whole grains, and healthy protein sources such as fish, beans, and lean meats. They should also avoid smoking, limit alcohol consumption, and highly processed foods, and have regular health checkups to monitor blood pressure, cholesterol levels, and stomach health. Blood type B. People with blood type B generally do not appear to have a noticeably higher cardiovascular risk than those with blood type A. However, some studies suggest they may have a higher likelihood of developing certain metabolic disorders, such as high blood pressure or type 2 diabetes, in some populations. The evidence, however, remains inconsistent. A diet high in sugar and saturated fat combined with a lack of physical activity may increase the risk of weight gain and insulin resistance. As a result, people may experience lower energy levels, fatigue, and a greater likelihood of developing chronic diseases as they age. Individuals with blood type B should maintain a healthy body weight. Engage in at least 150 minutes of exercise each week. Eat plenty of vegetables and limit sugary drinks, sweets, and highly processed foods. Regular blood sugar and blood pressure screenings become especially important during middle age. Blood type A, B. Blood type AB is the rarest blood type in the ABO system. Some studies have found that people with blood type AB may have a slightly higher risk of developing blood clots and stroke than those with blood type O. A few studies have also suggested a possible association between blood type AB and an increased risk of cognitive decline later in life, although no direct cause and effect relationship has been established. If cardiovascular and cerebrovascular health is not well maintained, individuals may experience dizziness, fatigue, reduced concentration, and a greater risk of cardiovascular events as they grow older. To reduce these risks, people with blood type AB should maintain healthy blood pressure, control cholesterol levels, exercise regularly, get adequate sleep, and avoid smoking. Activities such as brisk walking, cycling, and swimming are particularly beneficial for maintaining healthy circulation. Blood type O is generally associated with a slightly lower risk of heart disease and blood clot formation compared with other blood types. However, this does not mean that people with blood type O are immune to disease. Some studies suggest that individuals with blood type O may have a higher risk of stomach ulcers and infection with Helicobacter pylori. If left untreated, stomach ulcers can cause abdominal pain, anemia, persistent fatigue, and a reduced quality of life. People with blood type O should eat regular meals, avoid excessive use of nonsteroidal anti-inflammatory drugs, NSAIDs, unless recommended by a healthcare professional, limit spicy foods and excessive alcohol intake, and seek medical attention if they frequently experience upper abdominal pain, bloating, or signs of gastrointestinal bleeding. Why do many people feel more tired as they age? Many people believe that their blood type is responsible for chronic fatigue or accelerated aging. In reality, most cases of persistent fatigue are linked to inadequate sleep, chronic stress, anemia, thyroid disorders, diabetes, heart disease, depression, or a lack of physical activity. As we age, muscle mass naturally declines, metabolism slows down, and the body's ability to repair damaged cells becomes less efficient. These are normal biological processes that occur regardless of blood type. Blaming fatigue solely on blood type may cause people to overlook other important medical conditions that require proper diagnosis and treatment. Healthy habits that may slow the aging process. Regardless of blood type, research consistently shows that the following lifestyle habits can reduce the risk of disease and support healthy aging. Eat plenty of vegetables, fruits, legumes, whole grains, fish, and nuts. Limit highly processed foods, processed meats, sugary beverages, and foods high in saturated fat. Engage in at least 150 minutes of moderate physical activity each week, along with strength training exercises. Sleep 7 to 9 hours each night to allow the body sufficient time to recover. Maintain a healthy body weight and waist circumference. Avoid smoking and limit alcohol consumption. Monitor blood pressure, blood sugar, and cholesterol through regular health checkups. Manage stress through relaxation techniques such as meditation, deep breathing, or spending quality time with family and friends. Should you follow a blood type diet? Over the years, several diets have been promoted based on blood type. However, there is currently no strong scientific evidence demonstrating that blood type diets reduce disease risk or improve longevity better than a generally healthy, balanced diet. What matters most is not your blood type, but what you eat every day, how physically active you are, how well you sleep, and whether you effectively manage major health risk factors. Conclusion: blood type may be associated with a slightly different risk of certain diseases, but it represents only one small piece of the overall health picture. No blood type has been scientifically proven to cause people to age faster or die earlier. A healthy lifestyle remains the single most important factor for maintaining long-term health. Whether your blood type is AB, or O, eating a balanced diet, exercising regularly, getting enough sleep, managing chronic health conditions, and having routine medical checkups can significantly reduce disease risk, maintain energy levels, and improve your quality of life for years to come. Fortunately, this advice applies to everyone. Your body cares far more about how you treat it each day than what blood type you happen to have.